Just when the world thought it could finally breathe after the devastating impact of COVID-19, a new threat has emerged. A virus spreading silently but rapidly across continents, challenging healthcare systems still reeling from previous viral battles. It's called human metapneumovirus, or HMPV.
HMPV, HMPV,
HMPV.
HMPV, HMPV.
It's sending ripples of concern across China, India, the UK, and beyond. With its unprecedented surge in cases raising alarms among global health authorities and medical experts worldwide. While most respiratory viruses announce their presence with predictable patterns, HMPV has emerged as a stealthy adversary, spreading through communities with an efficiency that has caught many off guard. Could this be the harbinger of the next pandemic? Or are we finally uncovering a long-present respiratory illness that has been hiding in plain sight, quietly contributing to seasonal respiratory burdens while escaping proper scrutiny? Before we dive in, make sure to subscribe to Fit Journey Hub and give this video a thumbs up. The rise of HMPV. The first warning signs emerged in northern China, where pediatric wards began reporting an unusual and concerning pattern. What initially appeared to be a typical seasonal surge in respiratory infections among children soon revealed itself to be something more significant. Doctors noticed that standard treatments weren't yielding typical results, and the spread was faster than expected. The virus didn't stay contained for long. Within weeks, healthcare facilities in India and the UK began reporting similar patterns, with pediatric units and elderly care facilities particularly affected. The timing couldn't have been more opportunistic, coinciding with the cold winter months when respiratory viruses traditionally find their perfect breeding ground. Hospital admissions began climbing, putting additional strain on healthcare systems already stretched thin by seasonal pressures. It presents like a typical flu or common cold, making initial diagnosis challenging and allowing it to spread undetected through communities. Health officials have issued stark warnings. This virus's ability to transmit efficiently while masquerading as familiar illnesses makes it a unique challenge to public health systems worldwide. The virus's rapid spread, combined with its ability to cause severe illness in vulnerable populations, has prompted infectious disease experts to reevaluate their approach to respiratory virus surveillance and control measures. What is HMPV? HMPV, or human metapneumovirus, represents one of medical science's more intriguing recent discoveries. First identified in 2001 by vigilant researchers at the Netherlands' Erasmus Medical Center. This revelation was particularly striking given the virus's prevalence. Studies show it infects nearly every child by age 5, making its late discovery all the more remarkable. While headline-grabbing pathogens like influenza and COVID-19 have dominated public health discussions, HMPV has operated as a silent but persistent threat to respiratory health worldwide. The virus's infection mechanism is both sophisticated and stealthy. It infiltrates the human body through the nose, mouth, or eyes, typically hitching a ride on respiratory droplets or through contact with contaminated surfaces. Once inside, it demonstrates a remarkable affinity for respiratory epithelial cells, using specialized proteins to attach to and invade these crucial barriers. Like a master locksmith, HMPV has evolved precise tools to breach cellular defenses, turning each infected cell into a viral factory that fuels its spread throughout the respiratory system. Symptoms and danger zones. The insidious nature of HMPV lies in its initial presentation. What begins as a seemingly routine cough, low-grade fever, or scratchy throat can rapidly evolve into something far more serious. While many healthy adults might weather the infection with relatively mild symptoms, the virus reveals its true dangers when it encounters vulnerable populations. In these cases, it can swiftly escalate to cause severe bronchitis and pneumonia, potentially requiring hospitalization. Children face particularly high risks from HMPV infection. Their narrower airways and still developing immune systems create a perfect storm of vulnerability. When HMPV strikes, it can transform routine breathing into a laborious struggle, with inflammation and mucus production conspiring to obstruct these vital airways. For parents and healthcare providers, what starts as typical cold symptoms can quickly become a race against time as the infection progresses. The first patient zero. The discovery of HMPV in 2001 opened a fascinating window into viral evolution and human medical history. While this marked its official entry into the medical lexicon, genetic analysis suggests a much longer relationship with human hosts, potentially stretching back centuries. The search for the original patient zero remains one of virology's most intriguing mysteries. Like pieces of an ancient puzzle, scientists have tracked genetic variations and mutations, suggesting that HMPV likely emerged from an avian ancestor before adapting to human hosts. This evolutionary journey raises compelling questions about viral adaptation and spread. How did this virus perfect its ability to transmit between humans while remaining virtually undetected by the medical community for so long? The answer likely lies in its subtle presentation and ability to mimic other respiratory infections, allowing it to spread across continents while masquerading as more common ailments. Essential care and prevention for HMPV. With no specific vaccine or antiviral treatment for human metapneumovirus, prevention is crucial. Here's how you can protect yourself, your family, and your community from this highly contagious virus. 1. Personal hygiene. Good hygiene practices are your first line of defense. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or touching public surfaces. When soap isn't available, use a hand sanitizer with at least 60% alcohol. Avoid touching your face, particularly your eyes, nose, and mouth, as these are the virus's main entry points. Small changes like this can significantly reduce the risk of infection. 2. Social precautions. HMPV spreads easily through respiratory droplets, so maintaining social precautions is essential. Keep a safe distance from individuals who are visibly unwell. If you're sick, stay home. By doing so, you not only speed up your recovery but also help prevent the spread of the virus to others. Always cover your mouth and nose with a tissue or your elbow when coughing or sneezing, and immediately dispose of used tissues in a covered bin. 3. Extra precautions for high-risk groups. Certain groups, including infants, older adults, and those with weakened immune systems, are more vulnerable to severe symptoms of HMPV. These individuals should take extra precautions, especially during the peak of respiratory illness season. Wearing masks in crowded or poorly ventilated areas is a simple but effective way to minimize exposure. If symptoms develop, seek medical advice promptly to ensure early intervention and appropriate care. Comparing HMPV to COVID-19. While HMPV doesn't match COVID-19's mortality rate, dismissing it as a minor concern would be a dangerous miscalculation. HMPV exhibits remarkable efficiency in transmission through respiratory droplets expelled during coughing, sneezing, talking, and even normal breathing. These microscopic particles can linger in the air or settle on surfaces, creating multiple transmission vectors that make containment challenging. This similarity in transmission mechanics means that many of the public health lessons learned during the COVID-19 pandemic remain relevant. The virus poses a particularly severe threat in regions with limited healthcare resources. In these areas, where medical infrastructure often operates at capacity, the emergence of HMPV alongside existing seasonal respiratory illnesses creates a perfect storm. Hospitals and clinics already struggling with basic care can find themselves overwhelmed when HMPV cases surge, especially during peak respiratory virus seasons. The burden becomes exponentially heavier in communities where overcrowding and limited access to sanitation facilities make prevention measures difficult to implement. From the bustling streets of Beijing to the crowded markets of Mumbai, and across the neighborhoods of London, HMPV reminds us that infectious diseases recognize no borders. This isn't just another health warning. It's a call to maintain the global solidarity and vigilance that helped us weather previous health crises. Each one of us plays a crucial role in protecting not just ourselves but our entire communities. Don't let pandemic fatigue lower your guard. The threat of respiratory viruses remains real, but so does our ability to face them together. Stay informed, stay prepared, and most importantly, stay connected. Remember, the smallest actions, like proper hand washing or staying home when sick, can create ripples of protection through our communities. If you found value in this information today, take a moment to support Fit Journey Hub by hitting that like button and subscribing. We're committed to bringing you accurate, timely information about the health challenges that affect us all. Share this video with family and friends. Knowledge truly is power, and in this case, it could be life-saving. Together, we can build a more informed, healthier world.